Haiti is located in the Caribbean on the island of Hispaniola. It shares the island with the Dominican Republic. As of July 2013, the population of Haiti is 9,893,934. Of the population, 95% is black and the remaining 5% is white or biracial. The two official languages are French and Creole, but Creole is the primary language spoken by most. The population is largely Roman Catholic with some growing Protestant influence. While 96% of the country practices Christianity, roughly half of the population still practices voodoo. Political and social issues have played a large role in shaping Haiti's future. Warfare between France and emancipated slaves for control left the land and plantation system in ruins. Haiti gained independence from France in 1804. Before the war, Haiti relied heavily on income and nutrition from the plantation system, which was successful because of slavery. After the end of slavery, the nation was devastated by deforestation used for economic gain, which ended up hurting productivity in the long run. The end of slavery also brought about racial tensions that led to socioeconomic disparity for the majority of the country. On January 12, 2010, a 7.0 magnitude earthquake struck Haiti, changing the trajectory of change and improvement happening in the country. CNN reports that the death toll was between 230 and 316,000. 1.5 million people were initially displaced, with hundreds of thousands still living in IDP camps currently. The government and other aid agencies have been working hard to get Haiti back on its feet. Mortality and morbidity in Haiti are caused mostly by communicable diseases that are endemic to the population. Tuberculosis is an infectious disease that mostly affects the lung function of an individual and causes severe chest pain and coughing episodes. 14,000 cases of tuberculosis were reported in 2007, and one-third of all individuals who contract tuberculosis in Haiti die from the disease. AIDS damages the immune system and renders the body unable to fight off other disease. Many people with AIDS do not die of direct causes of AIDS. Most die from the other diseases they contract because their immune system is unable to fight them off. In 2005, there were 190,000 people in Haiti living with the disease. Malaria, a parasite transmitted through the bite of mosquitoes, causes patients to undergo recurrent attacks of intense shaking chills, high fever, and profuse sweating. It can also cause vomiting, headache, and diarrhea, which can lead to dehydration and other problems. In 2007, Gideon Informatics reported 25,000 cases of malaria in Haiti. In the rural village of Crochet, Haiti, 44% of children under 5 suffer from diarrhea on any given day. When diarrhea persists for more than 2 days, it begins to put the body at risk for dehydration and malnutrition, which can lead to death. Cholera became a huge problem after the 2010 earthquake, which led to deteriorating sanitation and hygiene. The problem was the worst right after the earthquake, but continues to be a serious problem in Haiti currently. In 2013, OCHA reported that there were 34,328 cases, January through August. Lymphatic filariasis, a neglected tropical disease in Haiti, is spread through mosquitoes. People who display symptoms most often develop elephantiasis, swelling of the legs, arms, breasts, and genitalia. In coastal Haiti, 50% of people have the parasite. Soil-transmitted helminths is also a neglected tropical disease. Transmission of the intestinal worms occurs through soil, food, and water that are contaminated with infected feces. In some of the most affected areas, 73.7% of children are infected. It can lead to malnutrition, stunted growth, intestinal obstruction, and distended bellies. The health status of infants and children in Haiti has been steadily improving. However, the odds of a child dying before his 5th birthday are 70 deaths and 1,000 live births. The leading causes of death in children under 5 years old are infections, malnutrition, injuries, HIV and AIDS, tuberculosis, and malaria. Overall living conditions for children are not ideal in Haiti. Just over 50% of primary school-age children are enrolled in school, and only about 2% of children complete secondary school. A lack of maternal education often leads to improper medical care and improper nutrition in young children. Many women die from ailments directly related to being a female and bearing children. The 3 most common causes for maternal death in Haiti are hemorrhage, hypertension, and abortion. The United Nations Population Fund reports that maternal mortality rates were 300 deaths per 100,000 live births in 2009. Many maternal deaths are due to lack of skilled attendants at delivery or lack of antenatal care. Only 26% of all pregnant women have skilled birth attendant present at the birth of their children. Gender disparities still exist quite obviously in some parts of society. Haiti has implemented a Ministry of Gender and Women's Rights, which works with the government to ensure that women have equal rights. As the poorest country in the Western Hemisphere, Haiti has much room to improve on the Millennium Development Goals. To improve on the first MDG, Haiti has started many feeding programs for children through school or health clinics. Many NGOs have programs for children and families living in poverty. Education has also become a big concern in Haiti. The country is on its way to universal primary education and including young girls in schooling. Infant mortality rates have always been a concern, but new, more affordable ways to access healthcare and birth attendance are beginning to become available. The same is true in efforts to reduce maternal mortality rates, which have been declining in recent years. Nehemiah Vision Ministries is an international faith-based organization in Chambron, Haiti. The purpose is to help children, families, and their communities meet the basic needs of life through education, health, and spiritual development. NVM believes in providing people an opportunity to live in an environment where they can be trained and equipped to contribute to their own personal development and eventually to the rebuilding of Haiti.